and the centrally placed umbilicus. It's a normal finding. Most of the patient having normal finding. Now, other than after this, the shape of the abdomen and umbilicus, we have to look for any scar for any previous surgery that any done to the patient. Firstly, we have also taken the history, so we will get a prior informed that which surgery happened to the patient. We only have to look for the scar. It's for laparoscopic or open, that the which quadrant that surgery happened. After the scar, we have to look for the any abdominal distension. We look for the distension. We look for the any engorgement of the veins or any caput medusa. From that, we have to get the idea of that portal hypertension or anything. Now we have to look for the normal color of the skin, normal color of the umbilicus, normal color any of the region of any of the quadrant of the abdomen. From that, we have to identify or differentiate diagnosis. Now get for the hematoma or lump or any FCS formation. We just have to look the normal color of the skin. After that, we have to look for any visible palpation or any visible organomegaly. And after the abdominal examination, we have to must look for the inguinal total examination in any male patient. But due to the patient's denial consent for the video consent for the inguinal total, so we do not do the inspection or demonstration of the inguinal total examination. But any abdominal examination is a must for the inguinal total examination. It's necessary. Now we go for the palpation. For now palpation, you must have used the gloves for the touch the patient's body. Now for the palpation, we must use the surgical gloves. Now it's I will demonstrate also the how to wear the gloves in a surgical manner. Touch, right? For the palpation, you must go for the first per abdominal examination. For the per abdominal examination, you start from the normal side. If patient having a pain at LIF or LHC, then you start for the RIF or RHC. Now you go for the softly for the per abdominal examination for the rounded from the normal side to the complaint side, right? If you have the patient pain at the LIF side, then you go for the RIF, then slowly to the from opposite side to the surgical side, right? This is the per abdominal examination. You must go for the per abdomen is soft, non-tender, non-insension, rigidity, guarding. Then before that, you must check for the local side temperature. If there is a temperature, you have to use back of the finger side and just go for the if patient having pain at LIF, if or a patient having a swelling or lump or any of these finding, you must check for the patient's temperature. Its localized temperature is increased or not, because if you done after the whole abdominal examination, it must your finding maybe changes because the tenderness increase or any other swelling, any other examination or the lump is found. After that, we must go for the quadrant by quadrant, that is RIF, RIL, RHC. You have to check for any lump formation or any palpable mass. So this is the epigastric region. This is the right hypochondrium. This is the right lumbar, right iliac fossa. All this examination, any palpable examination, you must do after the patient both legs are extended in position. This is the most important for any abdominal examination finding, right? You have to check the quadrant run by run for any palpable mass examination. If there is a RIF mass palpation, then there is a multiple differential diagnoses. Like first we have to thought it's RIF, so we thought it's a appendicular FCS or a cecal mass or a right adnexal or ovarian mass. If you thought there is a main 3 to 4 differential diagnosis, then if you for epigastric mass palpation, there is a GB mass or there is a gastric mass or any the hepatomegaly or there is splenomegaly, anything you can find. If there is a RIL, right lumbar region, hypogastric region, anything, you have to check every quadrant must for any mass palpation. After that, if there is a visible organomegaly, then you must find any palpable mass at any quadrant. You must localize that quadrant, and there is a multiple differential diagnosis throughout its thing. Now there is a visible palpation or anything. If there is a inguinal hernia patient, then you must check there is a inguinal region. Go for that palpable pulsation. If there is a direct, indirect, there is a two to three tests that are available. You can do this for this. That is the most important inspection and palpation. After that, we have the only auscultation and percussion. There is a multiple organ having a different style of percussion. If we have to percuss the liver, then also we have to start for the second or third intercostal space to below the seventh or intercostal space. That is mainly done for the liver. If there is a hyperomegaly, you can feel palpate beyond that multiple time hyperopercussion. If normal and tympanic sound is present, auscultation you have must heard the bowel sound. If there is a obstruction patient, there is a no bowel sound present or any bowel abnormality. Otherwise, there is a normal bowel sound present in most of this patient. Thank you.